Hello, everybody, and welcome tonight. I am so excited to be hosting this. What probably seems a little random for a lot of you hopping on here, like pelvic floor therapy. What is she talking about? Women's health, women's wellness, all of the things. And I cannot believe the amazing response that I have been getting to this in my stories and talking about it. And when I shared this with a couple of the leaders in my organization, my company, Brittany was one of the ones. She was like, I am so excited about this. And so she's going to be sharing a little bit tonight as well. So my name is Alita Langford, and I am just really passionate about women's health. I'm passionate about helping moms feel their best. So 10 years ago, I was actually homesteading, teaching cheese classes. Okay, y'all, like raw milk cheese classes, selling, non-GMO meat and grass-fed everything. I was living off the land. My husband would joke, he was like, we are going Amish one light bulb at a time. Like that is where we were going. We were all in and we were homesteading. And we really learned so much about the lack of nutrients in our soil and just so much about how what we put into our bodies and how we take care of ourselves really matters, and it's an investment as we move forward, especially as we get older. Then when you're having babies, so I had four babies very close together for between 25 and 30. And I noticed that my body had started to change. You're going through hormone changes, you're going through cortisol levels. I put in my story earlier, I said it's hilarious. Like it's like you're literally in survival mode, like just trying to keep everybody alive. Like whether you're raising teens or toddlers, that's affecting your cortisol levels, that's affecting your hormones and maybe not making you feel the absolute best. So I started taking supplements that really helped me, that I'm a huge believer in, that you'll hear a little more about later on. Just something simple as a pink drink and an energy drink that I have become obsessed with, that is full of veggies and good for you, microbiome, and all of the things that can actually help with your hormones, your energy. And all the mothers were like, Amen. We need some energy up in here, that's actually good for you. So when my friend mentioned to me about pelvic floor therapy, okay, and I know a lot of you are like, let's get to it, we want to hear it, is I don't know about you guys, I wasn't like not willing to, I just didn't really know what it was. My education on it was just really low. So I thought unless you were just like peeing like a crazy person when you were jumping on the trampoline, which by the way, I'm going to call her Dr. Ashley. She's probably like, why are you calling me Dr. Ashley? But when she would crack up if she saw the post right now, there's so many pictures of me floating around the internet with other people that are like, do you pee when you jump on the trampoline? Do you pee when you laugh? You need to listen to this. I was cracking up. I was like, oh my gosh, I have like just become the poster child for pelvic floor therapy by accident. But I was just having some issues. I'm in my seventh pregnancy right now, 29 weeks. And my friend Megan Milakovic, who's on here, you can wave your hand. I think she's actually at the ballpark. She actually was jumping, a gymnast, trampoline, all the things. She's like, you have to try pelvic floor therapy. And I was like, okay, okay. She's like, no, really. And you have to go in to a therapist. And this is why I wanted Dr. Ashley to come on, because, and I told her on the phone before, I was like, I really want people to hear why it's actually next level to actually go in and see somebody versus just doing the YouTube videos. Like I see a lot of the moms are like, yes, who've maybe done this before, but I wanted to just turn it over. And if you guys have questions as she's talking, just put them in the questions, or in the chat, and I can kind of field them afterwards if she has time. But this lady, I met her literally like 3 months ago. She's probably like, yeah, this is hilarious. And she just like made me feel so comfortable and so secure and confident that it was okay, that maybe the exercises looked ridiculous when I first started them, and just really educated me. And I really was just really passionate about hearing all the things. So without further ado, she's amazing. She's a mom to two. She's killing it, doing all the things. Dr. Ashley, take it away.
Well, Alita, thank you so much. It's such an honor to be here and so excited to share about women's health and pelvic health and why it's so important. And you've spoken to that already of, um, man, there are just so many things, whether it's leaking, jumping on a trampoline, or preparing for pregnancy, or postpartum rehab, or post hysterectomy, or endometriosis surgery, or bowel dysfunction, pain with intercourse. I mean, anything in the pelvic region, pain, bladder, bowel, sexual function, it's all so important. It's so a part of our everyday lives. And so many women suffer with conditions or need some extra support. So I love that you mentioned just the importance and the value of coming into the office. And I couldn't agree more. There are so many phenomenal resources online that I so support and love, in addition to people coming into the office. But all of what we do is based off of what we see and what we evaluate both externally and internally. So we're looking at the whole person. We're talking breathing patterns, posture, strength, range of motion, tension, all sorts of things. Some people come in with chronic injuries or orthopedic type injuries. And so you need really specific hands-on work for some of those things that an online video isn't going to be able to give you that same level of individualized care. It needs to be tailored to your specific needs and body type and what you're dealing with. And so that's why it's so important to come into the office and get a full evaluation to see what's really going on. That way we can tailor those specific interventions to your goals and where you're at and to best support you and your journey. So I could talk all day about why I love pelvic health and the benefits of it, but I'll kind of leave it at that. And then if there's any questions, happy to delve deeper into some of those.
Okay, yes. So some people are wondering, like, so how does it help with not going, like, how it's hard to picture, like, is it exercises? Is it like, what is it that actually does it? And the other thing is this is actually a really good point because I think this was my situation too, is like the Kegels, like that's what you hear, right? You're like, oh, just do Kegels at home. And this one lady said actually Kegels made it worse because she had a super tight pelvic floor.
Mhm.
So can you maybe talk a little bit about that?
Yeah, absolutely. Yeah, so there are a lot of things out there that we see that are really beneficial exercises or interventions, but they may not be appropriate for what you specifically are dealing with. So some people come into the office maybe speculating that they have a lot of pelvic floor weakness when in reality they actually have a lot of pelvic floor tension that maybe they would not have discovered if we didn't do an internal assessment to look at strength, range of motion, coordination, endurance, kind of the full spectrum of things that we look at. So yeah, there's so many different interventions that we can offer for different whatever it is that you're going through, or whatever symptoms you might have. But for some people, Kegels are super valuable and a great part of their rehab journey. And then for others, we maybe tailor it a little bit differently. We focus on breath work. We focus on body mechanic, just different ways to kind of move your body and lengthen muscles versus working on contracting those muscles. So it really kind of takes looking at the whole person, watching them do movements, watching them. I know in your first session, I had you, squat and get on the floor and lie down on the table and breathe for me. And I'm, really looking at different elements of your body, not just focusing on the pelvis, looking at your diaphragm and your rib cage and your shoulders and your neck range of motion and how all of that's working together. Kind of trying to piece together what could be really causing, the problems that we're seeing, really getting to the root of that. And so, it's not always do these 5 pelvic floor exercises and you'll stop leaking. We might really have to take a big step back and kind of ask you more questions of, well, tell me what does it look like when you're at work all day? And, tell me how much are you lifting in a day? And let me watch you lift some things and see how you're using your abdominals or how you're using your breath and maybe make some tweaks there and then curate some exercises around that.
So good. So good. And I'm telling y'all, if you are hearing our voices right now and you have any of the symptoms like diastasis recti too, I don't even know what that is, but make it in there. Do I have
That's that
diastasis
ab
recti?
separation.
Okay. I don't know if I have that or not, but I'm assuming after babies, right? It like pulls this.
Ye Oh, yeah, so that diastasis recti, so your abs do separate during pregnancy to make space for your growing uterus, and then, oftentimes postpartum, women need some additional rehab to help those abs, fuse back together and to rebuild strength in the deep core and pelvic floor.
Awesome. And then does it help with active endometriosis or just the post-op removal?
Yes, absolutely. We do see and treat a lot of women with active endometriosis. So, really working to decrease their pain during their menstrual cycle, during ovulation, pain with intercourse. So, a lot of pain management tips, a lot of down regulating your muscles and your nervous system, helping to just manage those symptoms the best that you can so that you can just live the most functional life that you can. And then we do often see women after surgery as well to help regain strength, work through any scar tissue that might be present. So we see kind of that full spectrum there.
Okay, I love that. And then does breastfeeding, so here's a question, does breastfeeding hormone levels specifically, such as lower estrogen, does it affect pain in the pelvic area?
Yes, it absolutely can. Oftentimes, pain with intercourse, vaginal dryness, it can play a role in that. And so we work closely with OBs and midwives and a lot of people that are maybe receiving some hormonal support or estrogen support and kind of working kind of with your body as you're on that journey nursing and your hormones are all over the place and your body's in a totally different state. And so eliminating that pain. But yes, it absolutely can play a role in pain in the pelvic region.
I love this. Yeah. Because this is the thing. I think a lot of people, like, even for me, it's like I won't even really say all the words. Like, I'm just like, I'm gonna be over here like coding to you and you're gonna say it. But I mean, it really does. It makes such a big difference. And that's why we can see there's quite a bit of people on here, right? Like, you're not alone if you're showing up here wanting more information on it. But here is the thing that I would kind of leave you with this topic is that it works if you do the work, right? Like you want to go and you need to kind of be consistent for a little while and do the exercises. And I really, when I went in, I told Dr. Ashley, I was like, I'm committed to doing these exercises because what I noticed is it really affected my confidence in just feeling like strong in my pregnancy, like I like to feel, feeling like I could do any kind of workout I wanted to do without any issues. I was getting like boat sick, seasick on a cruise. And that's when I was like, this is just crazy. Like I'm literally like wetting myself and throwing, I'm like, this is too much. It's like affecting my confidence. I wanted better for myself. And so this is definitely an amazing, like I could not believe the difference in 3 weeks. Like literally like no more leaking whatsoever. It was truly, truly, and it's been that way. So truly incredible. So definitely helpful. I've sent a lot of people already to pelvic floor therapy because I'm just such a huge advocate for it. So Ashley, thank you so much for being willing to hop on here and share. I'm going to put in the chat her specific office, which is in Franklin, Tennessee. So if you're local, that's a really great place to start. But if you're not, just type in pelvic, literally all I did was typed in pelvic floor therapy in Google and found a therapist and I just started calling people and talking to their receptionist and kind of getting a feel. So Ashley is an amazing receptionist as well who made me feel very comfortable. So okay, this is a really good question and we'll end with this, Ashley, and I'll let you go. But she says, what are good questions we should ask to know if they meet our needs? Like to
Oh,
ask.
if pelvic
Yeah.
Yeah, absolutely. And I don't know if there would be a way I could share. We have like a pelvic health quiz that we sometimes will send out, or we have little flyers that, it's like, do you have any of these symptoms? Really, anything that's disrupting your function, bladder function, bowel function, sexual function, chronic pain, prenatal, postpartum season, wanting to feel stronger, really anything in that realm. I mean, gosh, there's so many things that people come, they're like, I don't know if this is even related. And it most oftentimes is. So if you're experiencing any pain, if there's anything that's kind of like what you were speaking to, Alita, if you are just not feeling empowered or confident in your body, if there's something in that realm, whether it's you're leaking or you have hemorrhoids or you have just weakness
Prolapse.
postpartum. Sorry, say that again.
Prolapse. There was
Prolapse is a huge one, yes, or any concerns of just a heaviness feeling in your pelvis. Um, any of that would warrant an evaluation to just get checked out and see what's going on, because no one should live in pain. No one should live with discomfort. Um, Intimacy shouldn't be painful. Pregnancy, you should feel really strong and empowered. Postpartum, you should feel empowered in that journey as well. And so, if there's any concerns in those areas at all, I just say give an office a call, give our office or wherever you're located a call, share what's going on, share those symptoms, and I can guarantee you there's so many other women with similar symptoms as well that are coming in to see us. So yeah, I would say I would kind of leave it at that, and yeah, encourage you to just give a pelvic floor therapist a call and see how they could help you feel more confident in your body.
I love that so much. So good. So I'm gonna put the phone number for her office and her stuff in the chat right now. And I'm going to introduce my friend Brittany, Brittany Rout, who is a homeschooling mom to four, like a super woman. And she has just that science brain and she knows her stuff. And so she's going to talk a little bit about her hormone journey and how she has helped kind of rectify all of that. Is it going to let you? Yeah, I'll do it. Sorry. It's because I put something on there. There, did that work?
Yes, thank you.
Okay.
Okay, so I'm sold on pelvic floor therapy. I'm a mom of four, and my kids know I do not jump on the trampoline. So you sold me, Dr. Ashley. Thank you. That was great information. Okay, so I'm going to talk a little bit about gut health and hormones. So when we're talking about women's health, we've got to talk about hormones, right? And we go like this. There's a lot going on, right? I tell my husband, like, if you could just live 1 month in this, you would feel, it'd just be different. But there is such a connection between your hormones and your gut microbiome. Okay. It's huge. So your gut microbiome is the balance of your good and bad bacteria. That's what that word means. So I'm going to share a little bit about my story of hormone imbalance and getting it balanced, and the gut health system that I use and that I know Alita loves too. But first, let's just kind of understand how this works. And it's going to get a little sciencey, but I'm going to try to simplify it, and hopefully it'll be valuable to you guys. So your gut health and your hormones are hugely connected. You may have heard about the gut-brain axis. Okay, so that's probably something you've heard about. But there's such a connection between your gut and your brain. Your gut has so many neurons, so many nerve cells, that it's considered like the second brain. And your neurotransmitters like serotonin, dopamine, glutamate, norepinephrine, acetylcholine are either produced in the gut or by gut neurons, like a huge amount of them. 90 to 95% of your body's serotonin is actually produced in the gut. So when you think about hormones and the things that impact your mood, your sleep, your happiness, anxiety, depression, there is a huge connection between gut health and those things that you can experience. Okay, so gut-brain axis is huge. Also, estrogen production. It's called the estrobolome, which was a new word for me, but that is a collection of GI bacteria that regulate the level of estrogen that's circulating in your body. So your estrogen production is linked to having a healthy and balanced gut. Okay, that's huge for women. And I think it's super related to, your pelvic floor, your overall health. and your insulin. So insulin is considered your master hormone. And this is because it's so important in regulating your glucose or your blood sugar, breaking down fats and proteins, and promoting the building up of tissue, especially muscle in your body. And I just want to say a word on protein, okay? Since we've got pretty much all ladies, I think 100% ladies here. Protein is huge in hormone regulation, okay? Protein is huge. And I'm telling you, from 12 years of working in a medical fitness facility and my background in health promotion, I've worked with hundreds of women with their nutrition. I'm telling you, you are probably not eating enough protein. I see this all the time. You need about 1 gram of protein per pound of body weight. Okay, so that means if you weigh 150 pounds, we're talking 150 grams of protein per day. Most women are nowhere near that protein level. And maybe you can't get quite that high, but I try to shoot for 30 to 50 grams of protein per meal. Okay, that's kind of a good general guideline. And just to give you an idea of what that looks like, 30 grams of protein. That is 5 eggs. Okay, like who eats 5 eggs in one sitting? Or 4 ounces of chicken, or 1.5 cups of Greek yogurt, or 1 cup of cooked lentils. Okay, so yes, exactly. Eggs have a lot of fat. I love eggs. Eggs are great. But if you think like, oh, I ate 2 eggs, that's all the protein I need today. No, it's so important to track your protein. And if you're not sure, use a free calculator like MyFitnessPal and see how many grams of protein you're getting in a day. This can be the beginning of just transforming your health. I have found that when women start to eat enough protein, it helps with your hormone regulation. It helps with weight loss, with energy. It's so many things. Okay. So get enough protein. You'll see a lot of things fall into place. I just had to get on my protein bandwagon for a minute because it's so important. But all that to say, your insulin is a very, very important hormone that's connected to your gut health, and your thyroid. And this is part of my story too. Your gut microbiome influences how you absorb essential nutrients. Okay, so like selenium, zinc, iron, those nutrients that your thyroid needs to function properly. You could be taking all the vitamins in the world, but if your gut is a mess and you're not absorbing, it's not benefiting you, right? Like you have to have a strong gut lining to absorb nutrients and also to keep inflammatory markers out of your bloodstream. If you guys have heard of leaky gut, that kind of sounds gross, right? But what it means is like things are leaking out of your gut into the bloodstream that should not be there. And that causes inflammation, and it causes all kinds of food sensitivities and issues that we have. So your gut microbiome, your gut health is critical. And here's how this played out in my personal health. I had 2 miscarriages. My first 2 pregnancies, I miscarried, and I was told like, that's normal, that's fine. But I felt personally like something's not right here. So I went to a fertility specialist and I dug into it, and it turned out that I had PCOS, which is polycystic ovarian syndrome, and it was linked to very high insulin levels. So even though I was like healthy and fit and a healthy weight and doing personal training, all the things, inside I was not balanced. I had a gut health problem. I didn't know it was a gut health problem. So this was before I learned about gut health, before I got on my supplement routine. And so the fix was to take metformin, which is a diabetes medication, even though I wasn't diabetic. And throughout the pregnancy, I had to take progesterone 3 times a day, get blood work every other day for the first 12 weeks. It was kind of brutal, but I had 3 children that way. Okay. Then I learned about gut health, and I started to focus on that. I also have Hashimoto's, so that's an underactive thyroid issue. So these are all gut health things that I didn't know were gut health things. But I started to do research, and I started my gut health system that I'll tell you guys about. But let me just tell you the result. After several months of being consistent, I saw my thyroid stabilizing. I was able to come down in medication for my thyroid, which was amazing. And when my husband and I decided to have our 4th child, I told him, you know what? I feel so balanced. I feel like my hormones are so much better than they used to be. I really don't think I need any medication. And we were able to have our 4th little baby, who's now 3 years old, with 0 medication, just using my gut health routine. And that is how powerful healing your gut microbiome can be. In fact, I have no symptoms of PCOS anymore. Like at one time I had an internal ultrasound and there were over 30 cysts on my ovaries. So like that was pretty significant. And now I have no evidence of it. I also used to struggle with chronic acne and that cleared up. I had no idea that these things were gut health related. But when I started my gut health routine, which was focused on nutrition, like I said, protein, I cut out some inflammatory foods, okay? The gluten, the sugar, the chemicals like artificial sweeteners, that kind of stuff, you know, get those inflammatory foods out of your diet, focus on protein and whole foods. And I use a gut health system called Triplex. I'm gonna just show it to you briefly. It's 3 products. One is called Slim. This is that pink drink that Alita mentioned that she loves. Comes in a couple flavors, not all of them are pink. But this is a prebiotic drink. So it's getting the good gut bacteria in there. It also helps balance your blood sugar. So again, insulin and blood sugar, huge for your overall health and hormones. And it helps with inflammation, helps with sugar craving. So I started drinking one of these every day and using BioCleanse and ProBio5. So BioCleanse is a magnesium supplement with antioxidants. So it is helping you flush toxins out of your body, keeping you regular, and getting antioxidants in to oxygenate your body. And ProBio5, which is a probiotic, 5 strains of freeze-dried probiotics so that it doesn't break down until it's in your GI system, as well as digestive enzymes. So that was huge. Like that was all I needed along with nutrition to regulate my gut health. It weeds out the bad bacteria and seeds in the good bacteria to just bring balance to your gut microbiome. And the other thing that I loved for my thyroid was X Factor Plus. So your vitamins, your minerals, your micronutrients are super important. And X Factor Plus packs that all in. You need selenium, you need zinc, you need iron. There's nutrients that you need for optimal thyroid health. And you know, your thyroid affects all the things as well. So X Factor Plus was super important for me in my journey. And because I was sealing up that leaky gut, I could actually absorb the nutrition I was getting, which is huge. It's also really important to make sure that your vitamins are in a bioavailable form, meaning that you can actually absorb and use them. And so these products are in bioavailable forms that your body can use, even if you have the MTHFR, it's in the chat, that genetic mutation that so many women have. It looks like a swear word. It's a genetic mutation. 40% of women have it. And if you have it, you can't absorb most vitamins that you would get like at the drugstore. So this vitamin combination is totally absorbable. So that's the thing that I loved, totally transformed my health. I've been using that system for 7 years. And honestly, like rounding 40 now, my health, my energy, my hormones are way more balanced than they've ever been. So I will wrap it up there and hand it back to you, Alita.
I love it. Thank you. Thank you. Thank you. So thank you guys so much for hopping on tonight. It was incredible. I use the same system that Brittany does. I also drink Active every day. It's like my thing. It's amazing. It's an energy drink that has S7 in it. Just truly amazing, amazing. Nitric oxide, like all the good stuff. And I take all of these pregnant, midwife approved, doctor approved, all the things. So I love that part as well. Especially since you can't, you know, even take a Tylenol when you're pregnant, right? They're like, don't take anything. I'm like, I've been pregnant 7 times. I'll tell you what I want to take. But this is amazing. It truly does help. And if you're interested in pelvic floor therapy, or if you're interested in hearing more about the supplements, you can feel free to message me and I can point you in the right direction, or get back with whoever invited you to hop on here. We appreciate you guys so much for coming. And yes, there will be a recording. I have literally, my messages are blowing up. Like, will this be recorded? We couldn't get in. So yes, we will. Thank you so much, Dr. Ashley. Thank you, Brittany. Thank you guys for hopping on and coming out tonight. And we hope that, first of all, that you'll take action, that you will take action about making yourself feel your absolute best. Life is too short to go on feeling not your absolute best. So thank y'all. Have a good night.